A new viral outbreak is causing growing concern in China, with hospitals struggling to handle a sharp rise in patients, particularly young children. This mysterious outbreak is believed to be driven by human metapneumovirus, that is HMPV, a respiratory virus that has been causing widespread illness, drawing comparisons to the early days of the COVID-19 pandemic. Though not new, this virus, which typically leads to cold-like symptoms, has become more prominent due to its severe impact on vulnerable populations. HMPV, first discovered in 2001, is a member of the same viral family as respiratory syncytial virus, that is RSV, known for causing cold symptoms, but sometimes leading to more severe conditions like bronchitis and pneumonia. It spreads primarily through respiratory droplets when an infected person coughs or sneezes, making it highly contagious, particularly in crowded areas. Health authorities in China have been monitoring the surge closely, as the country faces a rise in respiratory illnesses, with HMPV being identified as one of the major culprits. Reports from hospitals show overcrowding, especially in pediatric wards, with anxious parents seen waiting long hours while holding their sick children. Despite the alarming images circulating on social media, official reports have not yet classified the situation as critical, though the National Disease Control and Prevention Administration, that is NCDPA, acknowledges a concerning uptick in cases. Between mid-December and late December, respiratory infections spiked, affecting both the young and the elderly. While the situation is still under control, medical experts are cautious about the virus's spread, especially with the winter season worsening respiratory issues. The World Health Organization, that is WHO, has already flagged the increase in cases globally, pointing out that respiratory infections have been on the rise since October. In response, China has launched a pilot monitoring system aimed at tracking pneumonia cases of unknown origin, with a particular focus on vulnerable groups, including children under 5 and older adults over 65. Though no new vaccine or antiviral treatment has been introduced for HMPV, health officials recommend basic preventive measures such as frequent hand washing, wearing face masks, and avoiding close contact with infected individuals. The rapid spread of HMPV has also been reported in other countries, with Malaysia seeing a significant increase in cases. In 2024, the country reported 327 cases, marking a 45% rise from the previous year. Authorities there have urged the public to practice good hygiene and avoid crowded spaces to mitigate further transmission. Though the HMPV virus has been around for some time, its recent surge post-COVID has caught the attention of the global health community. Scientists remain divided on whether these outbreaks are more severe or simply more visible due to increased awareness following the pandemic. Regardless, as winter continues, experts stress the importance of vigilance in preventing the spread of respiratory viruses, particularly as many parts of the world are still recovering from the effects of COVID-19. While HMPV is not classified as a new pandemic threat, the sharp rise in cases has caused widespread concern, reminding people of the ongoing challenges posed by viral infections in our interconnected world. Stay subscribed for more videos.